Yes, please start.
Yeah. Good morning, everyone. I'm going to talk on my augmented reality innovation that recently we have done called the IMG AR for teaching, diagnostics, as well as counseling with augmented reality. So I'm Dr. PRASANNA Venkatesh, going to talk on my application. So this augmented reality application that we have innovated is in 4 dimensions. We wanted to use it real-time patient images which are high resolution for teaching, diagnostics, as well as for patient counseling and simulations. When you see an image in 2D, for me personally, I feel there is something more that we can add. So why not 3D, which gives me a high, and the 4D where we use hand trackers like the Iron Man Robert Downey that we can see. Ophthalmology being an imaging specialty, holograms are the future, which I tried to actually innovate and successfully did it. So I'm going to share this for the next few minutes as to how we use the holograms to create a 4-dimensional ophthalmic metaverse. The fundus and the OCT, if you see, it's quite self-limiting in that we don't really get one over the other. So what if we can have a fundus with the OCT intercept over it, and all dimensions of the eye from all the slices can be chosen, and we can actually treat the patient and also follow up him in such a way that you can choose any slices through means of holograms. So this is the hologram headset that we have created, and you can see that the user is actually walking through thin space, but when he uses this headset, all the images are in 4D. The eyeball models, the color fundus, autofluorescence, infrared, the brain structures, the cranial nerves, cerebrum, all these imaged are in 4D. And with the hand tracker, he can actually expand it, see the gonio structures, angle structures can be seen in gonioscopic view, Miyake apple view, the ciliary body structures, the electron microscopic view of the angles, and also the fundus images that we have done with confocal images. All these are real-time patient images which are unanimated that we see in a fundus can actually be examined and the diagnosis can be made. And this is a workflow. For a diabetic patient who comes into the hospital, a fundus and a OCT is done and it enters the hospital database. Our software intercepts it and it translates it under 60 seconds, it makes the hologram. And now a diabetic retinopathy with macular edema before treatment, you can choose the OCT slices from the same fundus plane, and we can see and also counsel the patient, not only a diagnostic tool, but also a counseling tool. So the patients can also be shown these headsets, these holographic headsets, and then be counseled as to in 4 dimensions what it is. So once we have placed the lasers and the anti-VEGF injections, again the same patient can be have a 4-dimensional counseling as to how things have settled down. So this will make them awe in of our services. Also it's 4D diagnostics. So this is after treatment. Also anterior segment structures like ASOCT, the retinal OCTs can also be studied. And for pre-surgical planning, this is a posterior polar cataract component that can also be planned before workup. So is this only for holographic headset? No. We have also given it in the smartphone as well. So all you need to do is install our application in the smartphone and you can see the holograms in the smartphone as well. Any slices can be examined, and augmented reality eyeball along with cranial nerve system, cerebral venous system. The unique feature of our holograms are we use real images like the fundus, the anterior segment, the slit lamp, and we also published this concept recently in the IJO. To summarize this innovation, it's a patent protected technology that we have filed recently. It's useful in 4D diagnostics, 4D telemedicine, 4D AI. It's a multimodal imaging retinal examination device with color autofluorescence and infrared, low vision rehabilitation counseling, useful for neuroanatomy pedagogy, which are all complex 3-dimensional structures that we are talking about, like the red nuclei, the cranial nerves, cerebral venous system. All these models have been created, and these are all real-time images that we have taken from the patient to reconstruct the 4-dimensional holograms. Thank you once again for the opportunity.
That was an excellent presentation, Dr. Prasanna. Dr. Prashant, what are your views on it? How practical is it? What would be the cost involved? And how can it penetrate deeper into the entire country?
Congratulations, a beautiful thing. Way of looking at it will be totally different, and in fact I think the way if you can incorporate more bigger digital multimodal imagings and all things, it will be really much more of a clinical use. Like you can see an actual lattice, Like now we have an UWFA, that is ultra wide field angio. You can show them a patient that this is your horseshoe tear. Well, you need a laser.
So now
it will be really good.
We are using Opto's fundus,
images.
and we have actually created that, sir.
That's
so
beautiful.
This hologram, it said it costs around 2 lakhs, but the one that we did in our smartphone, it is free of cost.
Okay.
Our idea is to create a module which is accessible to the mass population, and this is the QR code of the apps that we have created. Currently it's in Android. It is totally free of cost that we wanted to give. This is quite costlier, which is around 2 lakhs INR.
Each piece.
Yes, sir. But this one is free of cost. So who are not able to afford this, with the QR code, it's free of cost in their Android phone, which is available.
So would they be appreciating it in a 4D structure,
Yes.
or even on an Android phone?
Yes, sir. In Android also it's in 4D.
Okay,
Not
great.
only a single slice, any slices is available in Android as well. But the
Absolutely.
features are better with the HoloLens.
Great.
Yes, sir.
Great.